Dr. Alice, tell me, what is the latest technology that you're excited about and what does it do?
So one of the latest technologies is the cool peel laser that we're very happy to have on board. We're not a quick adopter because we want to make sure that something is time tested and to a certain extent and make sure that it lives up to the hype. But this one certainly does. So it's a fractional CO2 laser that has limited downtime. So instead of the CO2 laser that we use in OR, which is very effective but has 5 to 7 days of peeling, the cool peel can have just a day or so of redness and no major peeling. So you can literally go back to work the next day, as many of our staff have, and just minimal redness because many people don't have the week of downtime for the peeling to occur. So that's been a really nice addition to our rejuvenation armamentarium just in the past year. Otherwise, we continue to excel in fat transfer and continue to optimize the ways that we can do this, revolumizing the face using our own body's natural filler, which is fat, to carefully take it from the places that we may not want it and place it carefully into the areas of the face that will flatter our appearance. So that's something we continue to work on perfecting and getting the best possible results in.
So, this laser that we're talking about, it's also getting very common back home. Just wanted to clear one thing. I mean, does it actually lift the face as well?
Yeah, good question. So it tightens some and it helps to smooth the surface of the face. It's a common misnomer that topicals and lasers can truly create a lifting appearance. There's some radiofrequency treatments that get a little bit of a lift, but fractional CO2 laser gets a little bit of tightening. I wouldn't call it a lift. It's not going to straighten a jawline. It's not going to move a cheek back up to its youthful position, which our Lux Lift does. Oftentimes they can be sort of overhyped and oversold, but as long as it's done by someone who is knowledgeable about the procedure and they can tell you about the true benefits and realistic benefits, then I think it's a great procedure.
But what kind of person would you suggest it to?
I mean, really, there's a wide range of potential candidates for it, and you're absolutely right. It's not going to replace a lift. It's not a facelift in a handpiece. But most patients can really benefit from it. Anytime someone has some fine lines or dyschromias or irregular pigment, it can treat those and improve the tone and texture of the skin. You might get a reduction in pore size. So most patients that are starting to show a few fine lines, that's a good time to consider something like that. Even up to the later decades, the 80s and beyond, they can still benefit from laser resurfacing, and the settings just might be slightly different for optimum results for a given patient. But if once we have more advanced depth of the lines and wrinkles and things like that, then a lighter treatment isn't going to be as effective. They could still do if they say like I don't have the downtime, cool peel would still be a great procedure for them as long as they're willing to do several rounds.